So I think Albertans need to understand that things are bad right now, and it is going to be a tough couple months.
The hashtag running on empty trending in Alberta started by an Edmonton area doctor to share the exhaustion from the front lines of the fight against COVID-19.
To those who are working in the system on the front line, thank you, and unfortunately we do need to prepare for this to get worse before it gets better.
Alberta's chief medical officer not sugarcoating it.
I'll tell you, and I'm not exaggerating, that this wave right now that we're experiencing is as bad as the peak of the fourth wave, just in a different way.
While in previous waves, the pressure was in the intensive care or ICU, so far Omicron patients more likely to need normal hospital beds. Dr. Paul Parks is the top ER doctor for the Alberta Medical Association and says this and the record number of frontline staff, from doctors to nurses to cleaning staff and care aides, out sick with COVID or burnout, it is impacting patients, whether they come to the hospital for COVID or something else.
Family and patients are quite shocked when they come into our hospitals now and have to wait hours and hours to get into our emergency departments. And then doesn't stop in the emergency department. You know, they might be transferred up to a hallway up on the floors in the hospitals that are overflowing.
But Dr. Park says what is truly demoralizing.
It's an important question, and you're right, I don't have that information.
As Dr. Hinshaw can't answer the majority of questions up to those elected or in AHS.
That's a failure of our government's communication and leadership for sure. There is a disconnect right now between the reality of what the government is messaging and what the reality in our hospitals are right now, and it's really impacting how we can function in the hospital.
AHS President Dr. Verna Yu did write an op-ed to Post Media about the work to increase hospital capacity, and we're told she will join Dr. Hinshaw for an update Thursday to address the situation in Alberta hospitals.
The thing I always add is that I don't want anyone that's having chest pain or sick, we want to take care of you. So come to our emerge departments, come to our hospitals, but be patient. It's not what you're going to expect because we're understaffed, we're out of gas, and our department is full.
In Edmonton, Carly Robinson, City News.